Thank you for calling Pfizer First Connect. This call may be monitored for quality assurance. If you are calling about the Pfizer-BioNTech COVID-19 vaccine, thank you. We understand that you would like to hear more about our COVID-19 vaccine. Please press 3 to continue. Thank you for calling the Customer Service Center for the Pfizer-BioNTech COVID-19 vaccine, also known as Comirnaty COVID-19 vaccine, mRNA. The licensed Comirnaty vaccine has the same formulation as the authorized vaccine Pfizer-BioNTech COVID-19 vaccine, and the products can be used interchangeably to provide the vaccination series without presenting any safety or effectiveness concerns. The products are legally distinct, with certain differences that do not impact safety or effectiveness. Before we continue, I need to share the following important safety information with you. Comirnaty COVID-19 vaccine, mRNA, is an FDA-approved COVID-19 vaccine made by Pfizer for BioNTech. It is approved as a 2-dose series for prevention of COVID-19 in individuals 16 years of age and older. It is also authorized under Emergency Use Authorization, EUA, to be administered for emergency use to prevent COVID-19 in individuals 12 through 15 years and provide a third dose to individuals 12 years of age and older who have been determined to have certain kinds of immunocompromise. The Pfizer-BioNTech COVID-19 vaccine has received EUA from FDA to prevent COVID-19 in individuals 12 years of age and older, and provide a third dose to individuals 12 years of age and older who have been determined to have certain kinds of immunocompromise. The FDA-approved Comirnaty COVID-19 vaccine, mRNA, and the EUA-authorized Pfizer-BioNTech COVID-19 vaccine have the same formulation and can be used interchangeably to provide the COVID-19 vaccination series. An individual may be offered either Comirnaty COVID-19 vaccine, mRNA, or the Pfizer-BioNTech COVID-19 vaccine to prevent coronavirus disease 2019, COVID-19, caused by SARS-CoV-2. The emergency use of the product has not been approved or licensed by FDA, but has been authorized by FDA under an emergency use authorization, EUA, to prevent coronavirus disease 2019, COVID-19, for use in individuals 12 years of age and older, and the emergency use of this product is only authorized for the duration of the declaration that circumstances exist justifying the authorization of emergency use of the medical product under Section 564(b)(1) of the FDNC Act, unless the declaration is terminated or authorization revoked sooner. You should not get the Pfizer-BioNTech COVID-19 vaccine if you had a severe allergic reaction after a previous dose of this vaccine, had a severe allergic reaction to any ingredient of this vaccine. Tell the vaccination provider about all of your medical conditions, including if you have any allergies, have had myocarditis, inflammation of the heart muscle, or pericarditis, inflammation of the lining outside the heart, have a fever, have a bleeding disorder, or are on a blood thinner, are immunocompromised, or are on a medicine that affects your immune system, are pregnant, plan to become pregnant, or are breastfeeding, have received another COVID-19 vaccine, have ever fainted in association with an injection. The vaccine may not protect everyone. Side effects reported with the vaccine include: there is a remote chance that the vaccine could cause a severe allergic reaction. A severe allergic reaction would usually occur within a few minutes to 1 hour after getting a dose of the vaccine. For this reason, your vaccination provider may ask you to stay at the place where you received your vaccine for monitoring after vaccination. Signs of a severe allergic reaction can include difficulty breathing, swelling of your face and throat, a fast heartbeat, a bad rash all over your body, dizziness, and weakness. If you experience a severe allergic reaction, call 911 or go to the nearest hospital. Myocarditis, inflammation of the heart muscle, and pericarditis, inflammation of the lining outside the heart, have occurred in some people who have received the vaccine. In most of these people, Symptoms began within a few days following receipt of the second dose of the vaccine. The chance of having this occur is very low. You should seek medical attention right away if you have any of the following symptoms after receiving the vaccine: chest pain, shortness of breath, feelings of having a fast-beating, fluttering, or pounding heart. Side effects that have been reported with the vaccine include severe allergic reactions, non-severe allergic reactions such as rash, itching, hives, or swelling of the face, myocarditis, inflammation of the heart muscle, pericarditis, inflammation of the lining outside the heart, injection site pain, tiredness, headache, muscle pain, chills, joint pain, fever, injection site swelling, injection site redness, nausea, feeling unwell, swollen lymph nodes, lymphadenopathy, diarrhea, vomiting, arm pain. These may not be all the possible side effects of the vaccine. Serious and unexpected side effects may occur. The vaccine is still being studied in clinical trials. Call the vaccination provider or your healthcare provider if you have any side effects that bother you or do not go away. There is no information on the use of this vaccine with other vaccines. Patients should always ask their healthcare providers for medical advice about adverse events. Report negative side effects of vaccines to the U.S. Food and Drug Administration, FDA, and the Centers for Disease Control and Prevention, CDC. Visit http://www.vaers.hhs.gov or call 1-800-822-7967. In addition, you can report side effects to Pfizer Inc. at www.pfizersafetyreporting.com or by calling 1-800-438-1985. Please visit www.comernity.com for full prescribing information for 16 years of age and older and recipient and caregiver fact sheet for 12 years of age and older. If this is a medical emergency, please hang up and dial 911. To report a suspected side effect, adverse reaction, or concern about any Pfizer product, say report or press 1. Please note that information provided here is specific to the United States. Therefore, if you are calling from Canada, please say Canada or press 2. Otherwise, if you are a healthcare professional, please say healthcare professional. Or if you are a consumer, please say consumer. Please visit www.cvdvaccine-us.com for information on our COVID-19 vaccine, such as storage, administration, and frequently asked questions. So I can get you the help you need, please choose one of the following options. To listen to a recording of the fact sheet for healthcare providers administering fact sheet for healthcare providers administering vaccine, vaccination providers, emergency use authorization, EUA, of the Pfizer-BioNTech COVID-19 vaccine to prevent coronavirus disease 2019. COVID-19. The U.S. Food and Drug Administration, FDA, has issued an emergency use authorization, EUA, to permit the emergency use of the unapproved product Pfizer-BioNTech COVID-19 vaccine for active immunization to prevent COVID-19 in individuals 12 years of age and older. Summary of instructions for COVID-19 vaccination providers. Vaccination providers enrolled in the federal COVID-19 vaccination program must report all vaccine administration errors, all serious adverse events, cases of multisystem inflammatory syndrome, MIS, in adults and children, and cases of COVID-19 that result in hospitalization or death following administration of Pfizer-BioNTech COVID-19 vaccine. See mandatory requirements for Pfizer-BioNTech COVID-19 vaccine administration under emergency use authorization for reporting requirements. The Pfizer-BioNTech COVID-19 vaccine is a suspension for intramuscular injection, administered as a series of 2 doses, 0.3 milliliter each, 3 weeks apart.